I'd like you to imagine a journey that I'm going to invite you to come on. This journey is going to involve 100 of you, and we're going to go to a wonderful place which is about 3/4 of a year away from here. You're only going to have to walk maybe 4 or 5 kilometers a day. You're going to have a wonderful guide who knows exactly how to get there. Free food, free drink. The accommodation is fantastic. It's air-conditioned, it's warm. You're completely immune from any bad environment. There's one problem. Just before you get there, there's going to be a river that you've got to swim across, but almost everyone gets across it. And when you arrive there, we're going to provide you with great security for 5 years. Everything will be perfect. So would you come with me on that journey? Well, let me give you some figures. 70 of you won't even get to the river. This is out of 100. 3 of you won't get across the river. And the rest of you who managed to get across to this place of safety, more than 20% of you are going to be dead at the end of 5 years. Would you come with me on that journey? Of course not. But this is the journey that an embryo takes in a woman in Africa in the middle of a rural setting. We may not identify that that embryo has existed because the mother may reject it before implantation even occurs. But we know a large number of embryos are formed that the fallopian tube and the uterus don't accept. But then when we do get a pregnancy, there's a high risk of miscarriage. If we get past the miscarriage, there's the risk of preterm labor, of stillbirth, and many other things that can happen. When you get to the river, which is giving birth, many people don't make it through that. And then even when you're born, you're not going to survive very long if you live in Africa or a developing country. So pregnancy is life's most dangerous journey. Not for the woman necessarily, although I show you it is for some, but for an embryo, an egg and a sperm that's got together, the vast majority of embryos never make it through to 5 years of life. So pregnancy is incredibly dangerous. I want to illustrate to you today, in the short time that I've got available, why reproductive biology, reproductive medicine, and clear thinking can transform the lives of women, children, and men across the world. And most of this audience are scientists. You generate vast amounts of data. But I want to get you to think simply. How can you take simple thoughts and transform society? I'm going to give you 3 examples. So to remind you that 1 million babies each year don't survive the first day of life. 6.3 million children die before their 5th birthday. And every day, 820 women die in labor. What an amazing statistic. So I want to take you to this place and this man. This hospital is called Harare Central Hospital. And I grew up in Zimbabwe and I spent 30 years of my life there. And I learnt my obstetrics and gynecology in this hospital. When I was there, there were more deliveries in one hospital in that year than the whole of South Australia delivers in 1 year. I reckon the doctors we had were as good as any in the Western world. Our technology was fantastic. We could prick the head of the baby and do pH and all sorts of things on it. We were able to do electroencephalopathy on the baby's head. We were able to look at the brain waves. Our doctors were fantastic. Our technology was great. And yet, 100 out of 1,000 babies that were born in that hospital died. We'd done everything perfectly. At that time in South Australia, maybe 15 would have died out of 1,000. So what was the difference? The difference was out in society. And the first professor of obstetrics and gynecology, I consider the most influential person in my life. He only published 20 papers in his life. But any of you who are under the age of 40 in this room, you've been totally influenced by this man, and I'm going to show you why. You're all used to the London Underground diagram, which is considered one of the great inventions graphically of all time. This is just as good. This is called a partogram. And up until the time that Philpott came to Adelaide, no one had ever graphically shown what labour looked like. And he took a very simple context. This line is the way that the cervix dilates in a woman. And he noticed that if he waited 4 hours and then took action, that the woman would still be all right. So let me illustrate this. So this is the cervix dilating in an African woman where progress was really slow. And often women would go on for 7, 10 days in labour. The baby would die, they would die. This is what should happen to a normal cervix in labour. It should go to the left of that line. And this is what happens if things are going slowly and then you do something. You give oxytocin or you make a decision about caesarean section. You can save the mother and the baby. Nobody thought of this before. It took an African doctor to think of this. Within a year, I remember people from UK coming and learning this. Soon these graphs went into the UK. Every hospital in the world now uses this. A simple reproductive observation on cervical dilatation led to a simple chart, led to massive changes across the world, and within 5 years we dropped that death rate from 100 to 40. However, what Philpott reminded me is he said we can't go any better than this. We can get down to 40, but until we change society, we're not going to do anything further. So science has got a limit. Great thinking takes us a long way, but we have to engage with society. So we live in a world where you'll see some of these figures. 175 million children affected by disasters. 1 in 5 people live on less than $1.25 a day. And you can look at all the other figures. Until we change society, it doesn't matter what we do in science and medicine, we can only get to a certain level. You have to be politically involved. So here's another hero. Basil Hetzel is a South Australian professor who spent most of his life looking at thyroid and iodine and thyroxine pathways. He was a clinical scientist. But he got involved in Papua New Guinea, and it was noted there that a lot of women had goiters, and it was also noted that there were a lot of children being born with intellectual deficiency. Hetzel put this together and realized that the mothers were thyroxine deficient, and if he could get their thyroxine up, the babies would be born with a good brain. And he did a clinical trial, a massive clinical trial, beautifully conducted in Papua New Guinea, and conclusively shown that giving iodine to women reversed brain damage. His science led to a simple idea, led to political action, and led to outcomes for babies and mothers that were fantastic. Well, what about us? We've looked at poverty. What about prosperity? We live in a world where we're surrounded by revolutions, the reproductive revolution, the information revolution. I sit every day seeing patients who sit with their reproductive menus and tell me what they want in terms of their reproductive treatment, and you all deal with genetics. So in this world of menus, we have IVF. And I've been involved in IVF for more than 26 years. And one of the things that I noticed when I came to Adelaide, and that's where the Adelaide story is we were proud of triplets and quads, front page of our local newspaper, world's first quadruplets. Everyone was thrilled with that. But look at the perinatal mortality that you get in the top line here if you have multiple pregnancies. This is 3 times higher than if you have a single baby. So how can you be proud of that? We've got this wonderful science. We've transformed the life of infertile couples, and yet we're producing 30% of all our pregnancies are babies that are destined to have a very poor prognosis. So what did we do about it? Well, we got our lab going, we took political action, and we transform things in Australia. And I'd like to show you this. This is one of the greatest achievements of IVF anywhere in the world, and it's not necessarily based just on science. Look at the number of single embryo transfers that we've now got in Australia. We're up near 70 or 80%. In the UK, it's about 10%. Look at the number of 2 embryos going back, very few. Look at the 3 embryos, very few. And what's happened to the multiple pregnancy rate? Well, this last year we're down to 5% in Australia. No one in the world is better. How did we do this? Great scientists at the Queen Elizabeth Hospital working on giving us great embryos so that the doctors were confident. The doctors going out and convincing other people. And finally the patients saying, I want that. I don't want a baby that's got a high perinatal mortality rate. I'll take that. You can't shop around anywhere in Australia for 2 embryos now. You'll only get 1. Again, a simple idea, good science, political action, great outcomes for people. So this is my last slide. We're going to hear a lot today about the developmental origins of health and disease. And there's no doubt that across generations we influence each other. What happens to us as an embryo, as a fetus, as a neonate, predetermines later life. But it's also what the grandparents and the parents do in terms of the nutritional and environmental exposure that we give to our offspring. And I believe the only way that we're going to really address the big political, social, and other issues that Philpott mentioned is by combining basic biology together with good clinical investigation, and then finally with translating that in the community. So for all of you in the audience, whether you're a scientist, whether you're a clinical doctor, or whether you're a member of the public, together we can absolutely change the way that men, women, and their babies have a great outcome for later in life. And hopefully what happens in Adelaide can have a great effect back in Africa, in India, and in many other countries in the world where women, children, and their families suffer from these terrible things. Thank you.